So the one big thing we have here that everybody else in the country is aware of is Epic. So the nice thing about Madison is Epic is based here, and Epic has huge market share in the healthcare industry. So from a credibility standpoint, Madison is on the national stage. So it's not very often that that can happen.
But really, I would say even the reason that Epic was able to succeed here is in large part because of the diversity of the folks in this room. If you think about what the ideal healthcare ecosystem of the future, that the entire country is striving for, and really governments across the planet are striving for, is this idea that these three things get done. Electronicifying the record, getting kind of the electronic record kind of in the rear view mirror. Well, obviously, our state is in a very lead position for that. But beyond that, this is construct of really kind of getting to the point of having clinically integrated networks. But you've kind of just defined the majority of the health system around the state. Other markets don't have that. And lastly is the construct of bearing risk and sharing of risk between the health plan and the health system. And that really just defines what this market has been for 20-odd years.
The cost of doing business in Madison is so much lower. We can stretch our funds way further than in any other city. Our access to talent is amazing here at the university. From an outsider's perspective, Madison doesn't look as centralized, but when we come to events like this or come to other events that kind of bring these sorts of people together, we know that we all know each other, and it's a small community here, so we can actually use these relationships to kind of grow the different pieces of it more effectively, I think.
Of providers certainly do have a lot of ideas, and we have examples within our own organization of providers who have branched out and done some entrepreneurship, and it hasn't been easy. There isn't an infrastructure in place within our own organization really to support that. So we're starting to have some early conversations at UW Health about how could we create an infrastructure that would allow some of those novel ideas to come to fruition.
A bunch of structural things that really are quite trivial in the greater scheme of, here's how you should sell your license, here's how you should price it, here's how you should get started, here's why you should go after these health plans over here with these health systems. And so we're not yet mature enough as a market to support that, but I think we can.